the patient I brought to India. We're from Kenya. We were referred to India by a guy called Praveen, and he was the one who connected us to Dr. Meditriangle. And before that, my husband had an issue with the stomach. He could get bloated every time he ate food. He still could have some day of body weakness, like he could wake up in the morning and feel dizzy. He had a problem of walking. He could lack balance when he walks, and he had some diarrhea sometimes, and that's why we chose to seek medical aid. That's why we were referred here by the Prophet.
Now, Mr. Anthony, he had traveled to us from Kenya. Basically, he had a mass in his pancreas, and we worked him up. And when we did the investigations, we found there was a big mass on his pancreas head. Basically, that required a surgical intervention. Since he had previously undergone bypass surgery for his heart, he was diabetic, hypertensive, and or slightly overweight, that is obese. So it was a high-risk surgery.
We came to India and we met Dr. Meditriangle, and he ran some tests, and he found that we had a problem with the pancreas. And from there, he suggested we do a robotic surgery, whereby he wanted to remove the cyst that was on the pancreas. So he was admitted, and then the following day we went to surgery. Part of his pancreas and spleen were taken out, and he remained in the hospital for that week, and we got discharged afterwards. And right now we can see a lot of improvement and change. There's no more bloating, there's no diarrhea, the overall weakness is improving completely, and we think that we are on the right path.
So we discussed these parameters with their relatives, his wife and the patient, and explained them about the two procedures. That is, we can do the surgery by the open technique, or by the conventional where we cut open the abdomen big, or secondly by the use of minimal invasive technology, that is robotic technology, as that would have been safer for him considering his comorbidities. We opted for the robotic procedure. He underwent a safe robotic surgery when we removed 70% of his pancreas along with the spleen. He recovered really well. He hardly required any, I would say, time to recover, because he was walking the same day post surgery. ICU stay was even less than 12 hours, and within 5 days we could discharge him from the hospital. No blood transfusion was required. He hardly had any pain complaints. He was eating from day one. So basically, all the advantages of a robotic surgery in such a high-risk patient could be delivered to him in an efficient manner. And as you can see, seeing him, he has recovered really well. Otherwise, if you would have gone by the conventional technique, you could have had the problems of wound infection or some other problems, and that sometimes even lung-related complications with this upper abdominal surgery. It could have been a tricky exercise.
Initially, we encountered staff which were so helpful, they're cheerful, they're good, and the doctor was good to us. He did a good job. That's all I can say. He did a very good job, because it was a major surgery. They stayed in the theater for hours, and we got really anxious, and everything worked out well at the end. I think Dr. Meditriangle is a professional, he's competent, he's a good doctor. Yes.
So thereby we recommend all the patients who can benefit by the use of the technology, they should take the I would say advantage of the technology. And any patient suffering from any type of cancer, please do not hesitate to discuss your problems with us. And even robotic surgery and all other advanced form of surgical techniques like HIPEC and all, we are one-stop center for that. Thank you.